is there between Hridroga and Vegadharana. Next. You see, medicine should have the following properties. I already told that it should be Bhajana, it should be Deepana, it should be Anilomana, it should be Gulmahara, Srodohara, and Hridya also. What is the exact meaning of Hridya? Hridya means, if some medicine is taking the quality of other medicine to Hridaya. Actually, Hridya means, it acts as a vehicle. A Hridya vehicle acts as a vehicle. For example, if you are Vidaryadi Rayama Hridyo, Vidaryadi Gana is Hridya, which means that, if you are adding some medicines with Vidaryadi Kashaya or Krita, definitely Vidaryadi Kashaya or Krita will go to Hridaya. Then if you are adding some medicine with Vidaryadi, definitely it will go to Hridaya, because Vidaryadi Kashaya is having affinity towards the organ Hridaya. Next. You see, let us see. First of all, let me see. Haridagi is having all the qualities. Pajana, Deepana, Anilomana, Gulmahara, Srodohara, but it is not Hridya. You see, I am explaining how a drug is developed, how a treatment is developed for Hridroga. I am coming to that point. Haridagi is Pajana, Deepana, Anilomana, Ushna, Gulmahara, Srodohara, all these qualities are, but it is not Hridya. You see, cow's ghee is Hridya. Actually, ghee is having affinity towards many organs. It is having affinity towards eyes. That is why if Tripura is medicated, definitely that Tripura will go to eyes. If Kirva is medicated with some Nethya Ushadas, definitely it will go to brain. You may want Kalyana Krida, Makalyana Krida, many Kridas are there. All the Nethya Ushadas, if Krida is medicated with Nethya Ushadas, definitely it will go to brain. Then if Krida is medicated with Vidaryadi, definitely it will go to Hridaya also. Cow's ghee is considered to be Hridya. Hence, according to Ashtanga Hridaya, Hridroga Athikara, Hridroga chapter, when Krida is told, Sauvarchanasya Dipale, Pathya, Pajashadanyude, Kridasya Sathida Prusto, Hridroga Shwasa Gulma. Sauvarchanasya Dipale. So, Lekho Sauvarchanam Hridyam. This explained. Lekho Sauvarchanam Hridyam. Sauvarchanam is also a Hridya, and Krita is prepared with Sauvarchana and Haridagi alone. Because, if Krita is prepared with Haridagi, definitely the Pajana, Deepana, Anilomana, Gulmahara, Srodorodhara, all these effectively go to Hridaya. This is how a drug is developed. A treatment procedure is developed in Ayurveda. Actually, this is an analysis. Each and every disease, like in this way, we can analyze. According to Ashtanga Hridaya, Hridroga, this Sauvarchana, the Kritama is explained. This is the first medicine, and it is a Krita. You see, when we examine the Hridroga Athikara, many Kritas are put. Usually, cardiologists and other modern doctors, tell the people that you don't take any type of fatty material, including Krita or coconut oil. But according to Ayurveda, Krita is permissible to take, because, Krita is having Hridya effect, through which, we can induce medicines to the heart using the Hridya property of Krita. Next. You see, actually, here the patient is with us. You don't forget about the patient. The 62-year-old patient is sitting with us, and we explained how medicines can be given to him, analyzing all the basic principles and his clinical condition. You see, first of all, the medicine prescribed was Gandharvagastha Kashaya with the Saithava and Buddha. Gandharvagastha Jirvilla Hudasha Vishwa. In that the yoga, Saithava and Buddha can be added. Then Hingvachadi Churna with hot water. Krishnan, Vinman, Vadavinmotra Sangam, Kande Dantam, Hridgadam, Pandarogam, which is indication of in the indication of Gujadi Jurna, Kridroga is told. Then Vidaria the Kashai already told Vidaria the I am Kridyo. Here I am adding Gurgulu Panchabara Churna. If some Srodoro Tagara medicine is added to Vidaria the Kashaya, definitely it will go. This is my principle. Definitely it will go to Hridaya and the Srodorotha will be removed. We can remove the Srodorotha with Urgula Panjavara Churna. Urgula Panjavaram Barigamsham, Magatika, Triparaja Protectial, Tapudi Kashayudam, Matunitam, Pushta Pagandara Gulma Gadik. There, you see, the Droga is not a told. But we all know that, it is a very good Srodorotha Uchata, which can be added to Vidaria the Kashaya for getting this Srodorotha effect of Gurgula Panjavara on the organ heart. Honey is the animal of Gurgula Panjavara, that is why it is added. And here I have one more treatment, a Kerala Chilsa, which is Thanadaram Taira. It is very cheap, with 30 ml of Thanadaram Taira, we can do Guru for 1 day. And the patient continued this treatment for 1 month. Next. You see, in between we can say another you see, Chirvilladi Kashaya, Induganda Kashaya, Apiarita, Deshamurarita, Hanandaram Guliga, all these medicines can be also given. These are all next options, Panchavore Avagu is given in deep-seated Agni Madhya. Then Virejana with Trivur Lekam. You see, Trivur Kashayena, Sathida Sasidokima. That is Hridyam Virejanam. It is called, it is known as Hridya Virejanam, which is available at Vaidyaratnam Aushadashara. I think they are marketing this Trivur Lekam as the name of Hridya Virejanam. But in Kotak Ayurveda, it is Trivur Lekam. Trivur Kashayena, Sathida Sasidokima. This is called Hridya Virejanam. Mathu Trijada Samyuktu. Deho Hridyam Virejana. Then Shavana Prasha, Agastya Rasayana, Ram Rasayana, Milk Decoction, Stira, Arjuna, Rishuna, all these are good Rasayana for Hridroga also. Next. You see, after 1 month of this giving these medicines, actually the patient became alright. He was able to walk for, I think one slide we missed. Dr. Karthika, can you search?
Sir,
after 1 month, one slide we missed, I think.
No,
not missed.
No, sir. We have not missed.
Because there was one slide regarding the patient. After 1 month of treatment, the patient was able to walk for 30 minutes. And after 2 months of treatment, the patient was able to walk for 1 hour, which means that, we were able to remove the block which already occurred in the minute arterioles with our management. Because applying the basic principles in Hridroga, we were able to remove the block. This line of management I have used in many cases. Not always this Gandharva Sadhi Kashaya. I already told that in the Vanda, the many options are there. Actually, we can choose accordingly. But all these medicines are highly effective in the management of Hridroga. The only thing is that we have to protect Agni for protecting heart. That is my principle. Protect Agni for protecting the heart. This is very, very important. Sometimes, the patient may be having good appetite. That may not be, that is not the sign of good Agni. Because, Ahara Gamsha, Sojanam Dipaka, Purisha Mutra Anila Srishtadaja. Purisha Mutra Anila Srishtadaja is also a good sign of Agni. Agni Bala. For example, if the patient is having good appetite, but he is constipated, which means that, Agni Vaigardi is there. In that way, we have to see the patient in a very holistic approach. Then, what should be the preventive measures? Now, I think you all should have understood how a hridroga myocardial infarction can be managed. If you are getting sufficient time, definitely it's a time-consuming thing. 1 month or 2 months it may take, because this block occurred due to his apathya and vihara for many years. Many years of apathya only causes block in myocardial vessels. Hence, it may take some time. That is because when Jayarajigilsa Acharya says that Lankaram Saidanam Kalo Yavagus Chittagovarasa Alanam Pajananisya. Kala is an important content, important factor for curing the diseases. Here, one medicine can be a vehicle for another vehicle. There are many examples I can show you from our science. For example, in Mutraga Rektavitta, you see, in Mutraga Rektavitta Chikitsa, Acharya says that, Gogandaga Apiru Sundam Pandini Vistadavaya Andhyas Rektam Sarujam Visheshal Mutramargam Gogandaga Apiru Sundam Paya. You see, when hematuria is there, we can prepare Ksherakvasa with Gogandaka and Apiru. Actually, we all know that, Gogandaka is not at all having any kind of Rektastampana effect. But Apiru or Shatavari is having Rektastampana effect. That also we know very well. Shatavari is Shira also. That is having Rektastampana effect. Hence, if you are preparing milk itself is having Mutra Krishragara effect, which means that, milk is having some affinity towards the Mutravaha sodas. Which means that, if you are preparing Gogandaka, milk with Gogandaka and Apiru, the Mutra Krishragara effect of, or the affinity of milk and Gogandaka takes the Rektastampana effect of Shatavari to the Mutravaha sodas. Once again, I can say this Apiru is having Rektastampana effect, but it is not a vehicle. Here, Gogandaka and this milk acts as a vehicle which is taking the Rektastampana effect of Shatavari to the urinary system, by which, Rektastampana occurs. Which means that, if when hematuria is there, 2 doses of this Ksherakvasa is sufficient to arrest the bleeding in the urinary system. That much effect is there. Which means that, there are many other examples also. For example, when Acharya explains about, Udashvayasa Shularto, Mandagdir, Gavalmigan Pibel, Hingwadi, and Takramba. You see, in Arshojinsa, Acharya says that, when the patient is having Udashvayathu or Udashula due to arthritis, definitely we can select, Hingvajadi Churna, which is told in Gulma Chikitsa, which is having Arsohara effect, but it should be given with Takra. Why Takra is preferred here? Acharya should have preferred hot water also, but he is preferring Takra because, Shushkeshu Bhaladagam Agrimuktam Vaishajyam Ardeshu to Varsakatvam Sarveshu Sarvartushu Kalashayam. Kalashayam means Takra. Sarveshu Sarvartushu Kalashayam Arsasu Delyamcha Malavahamcha. Here, Kalashaya or Takra acts as a vehicle for taking the Arshohara effect of a Gulbahara drug to the Arsho area, then to the Arsas. Once again, I can say here, Kalashaya or Takra is acting as a vehicle for getting the effect of Arshohara, effect of Hingvajadi Churna, and that is why the patient is having relief with 2 or 3 doses. Usually, a lady in her, when she is pregnant, in her 3rd trimester, she may be having some level of access. Physiological access actually occurs, and after delivery, usually it is goes also. But when the patient, when that lady is in the third trimester, there may be many patients I have treated. The patient may be having, that lady may be having painful defecation. At that time, the best drug is Hingavajadi Churna with Takra. Best 2 or 3 doses will be sufficient to subside the symptoms. Then let us go to the preventive measures of Hridroga. Intake of food after having proper appetite. Proper appetite means, if you are having Yamamathena Bhoktavyam, Yamayugmam Nalankayet, Yamamathe Solpatur, Yamayugmad Verakshaya. Which means that we should not take any food material within 3 hours. But within 6 hours we have to take. That is the theory. Within 6 hours we have to take the next step. But within 3 years we are not supposed to take any kind of heavy food, because the digestion is of the process, and in between if you are taking some food, definitely that will affect the proper digestion. Hence, intake of food after having proper appetite is very, very important. Then dinner should be very light, and it should be taken at least 2 hours before bedtime. Then water boiled with dry ginger and coriander can be used for drinking. Daily exercise. Many people think that this is a modern concept. No. I always say that Ayurveda has given much importance to this exercise. In one of the texts, I think in Susru Samhita, it is told that Kape Prachardanam. In Kapa, Prachardana is the treatment. Itte Virepo, Vasti Hirane, Vasti for Vada, Shasyade, Trishwabisada, Vyayamo Doshanachana. Which means that, Vyayama is Doshanachana for all the doshas, for Vada, Pitta and Kapha. But Vamana is only for Kapha, and Viredana is only for Pitta, and Vasti is only for Vada. But Vyayama is effective for all the diseases, all the doshas. Which means that that much of importance is there. Importance is given to Vyayama in our science. Then Vyayamam Gurvado Nityam. Virutham Abhivojanam. Vidaktham Avidaktham Va Nirdosham Paribachite. If you are doing sufficient Vyayama, we are permitted to take some level of Viruthahara or Vidaktahara, because that will be properly digested with the effect of Vyayama. Hence, Vyayama is having much importance in our science for getting proper digestion, and it is indicated in many diseases like Prameha, Saulya, and other metabolic syndromes. Then daily exercise is advised. Then Hingavajadi Churna. Then if somebody is asking to me, sir, can you prescribe a single drug or a combination drug which can, if we are daily taking for preventing Hridroga? I can definitely say that if you are taking daily Hingavajadi Churna with hot water, we can prevent Hridroga, because it is Pajana, Deepana, Srodhorodagara, all the properties are there, all the Hridroga properties are there for Hingavajadi. Hence, you can advise Hingavajadi Churna daily before food. Churnani Annasya Pura. It should be taken before food. Churnani Annasya Pura. It can be taken with hot water or any other media. Definitely that would be great, because if you are taking daily, we can daily this Ama Sanjaya can be prevented, and thereby Hridroga also can be prevented. Then Vegarotha, if you are telling about Vegarotha, the 3 important Vegas are Mana, Motra, and Athovayu, because in Rajeshma Chimsa, Acharya says that Sakasam Vegasamrotha Shukra Vijaseka Samchaya Annavana Vitityaga Satvara Sasya. 4 Hedus are there. Among the Vegarotha is also there. But this Vegarotha of 14 Vegas doesn't cause Rajeshma. Only three because Hrimatwadva, Krinitwadva, Hayatva, Vegamadam, Vadamutra Purishanam. The Vegara Rotha of Vada Mutra and Purisha alone causes Rajeshma. It is explained in Charagamira, which means that even though we tell about Vegarotha, Mana Mutra and Athova are very important because you see when Acharya explains about the poems, this Purva verses, he says that Edanyeva Vivarthande Jadeshu Hataramasu Nivartamano Apano Hi Stayatho Margarothe Chove and Nilan and Yan. Which means that he says that when Apana Vaigunya is there, that will cause the vitiation of all the other Vayus. Apana Vaigunya will cause Chohayan, Anilan, and Nyan, which means that this Mara Mutra and Athavayu related to Apana Vayu, hence Vegaratha Apana Vayu should not be done. Then tension free life. We need not explain about that. Next. Then Hridaya is a Mahamarma. I already told that. Protect it carefully even during external treatment time also. Actually, when we are doing medicine and other treatments, Hridaya should be protected. Always, Shito Upachara should be given to Hridaya. Dring Mushka Hridaya Nava. It is told when Acharya is explaining about Sweda Jinsa, Dring Mushka Alpam Vamshanayor, when the Dring Mushka Hridaya Nava. He always says that, according to modern science, only 30% of cardiac patients need immediate intervention, immediate angioplasty or immediate other level of treatment. But which means that 70% of patients who are undergoing angioplasty can be medically managed. I can boldly say that with Ayurveda also, if we are getting proper time, then medically manageable cases can be treated with Ayurveda so that angioplasty can be avoided, which needs continuous lifelong medication. Next. Then this is the type I am concluding. Time is almost 9 o'clock. Hridroga is not happened due to one day apatya. It's a cumulative effect of apatyas which is practiced for years. Cumulative ama plus Rodorotha plus Antarika Apikata. You see, we always say that Hridaya is a Sadhya Pranahara Mama. We always think about the external trauma which is occurring to the heart. But internal trauma is also very important. In the internal trauma is also important. Consider that is also Antarika Apikata, Satya Pranagara, results in Hridroga. Unhealthy lifestyle is followed for a very long period is the exact and premier causative factor of Hridroga. Treatment is healthy lifestyle and scientific management. There is no single drug, no Ottamuli is available for this fatal disease. Next. Thank you for your patient hearing. Actually, we spent almost 55 minutes explaining about Hridroga. This is the Hridroga line of management. Even though I explained about some medicines, many other medicines are there, and heart protecting rasayana ಔಷಧs are also there, which I already explained, like Agasya Rasayana, Brahma Rasayana, Chavanaprasha. Many medicines are there. We all know that those also can be used. Here I explained only about some medicines. There are many physicians who are having much experience in using this. But definitely you have to protect Agni because protection of Agni is the cardinal principle of Kaya Chikitsa. That is why we are using always this Panchagore, Avaku and all the other medicines for treating the deep-seated Agni disorder. Thank you all for your patient hearing. And once again, I am thanking Dr. Jasoor for inviting me, and that is why I got a chance to address you people. Young daughters, definitely you are the cream of the society. Definitely you should be able to treat these kinds of cases. We always are very fearful in treating Hridroga. If we need not be fearful because we also know the basic pathology of Hridroga very well. Thank you once again. Thank you all.
Thank you so much, sir, for being with us and sharing your experiences, sir. It was a wonderful session with explaining deeply how we can make a medicine.
Correct,
The concept behind it.
how we can formulate medicine.
Yes, right, sir. So that was a wonderful session.
When we explain about some medicines, for example, if you are taking some Deshamura Gadatraya Kashaya, usually it is given in Shwasaroga. You see, if you are examining the ingredients, Deshamura is Vata Kapahara always, and it is having some anti-inflammatory effect. That is another thing. It is Vata Kapahara. Actually, Vata Kapha is the dosha profile of Tamagashwasa. That is why then in Deshamura Gadatraya Kashaya, Deshamura acts as dosha vipirita. Then Kadatraya is totally Pajana. Because Swaso Hyamashya Samarpava. All the Amashya Samarpava medicines should be treated with the Pajana Uchala. Which means that Kadatra is Samprapti Nikatana. Then the other medicine is Vasha. Vashayam Nityamanayam, Ashayam Jividasya, Ektavitti, Chayigasi, Kimartham Amusidhi. Vasha is a good Shwasahara drug. Which means that Vasha is Vyati Pratiniga. You see, 3 medicines are there. One is Dosha Pratiniga, the other one is Vyati Pratiniga,